Hello, dear friends. Welcome to the Pundit Place, where we discuss curated content that have been thoughtfully designed to keep your health and management issues as well as lifestyle. My name is Jude, and I'm going to be your host for today. Today, we're going to be discussing the trauma care ABCD assessment of a trauma patient or a victim. Stay with me while we run through it together. So the first you need to note is, regardless of wherever an accident has happened or a traumatic event has occurred, the first thing you need to take note of is scene safety. You want to ensure that the scene is safe both for yourself. First, you are the first person, and then the second to consider is the safety of the victim. The third is the safety of everyone else. So you first, the victim second, and then every other person is safe. So these are the three safety concerns you need to take into cognizance. And by safety, we do not just mean being in harm's way. We also mean safety when it comes to legal implications of your actions and inactions. So once you have studied the environment, or you have realized that the environment is safe to approach, or the victim is safe to approach, then the first you need to evaluate is for exsanguination. So exsanguination is a term we use to describe a situation whereby there is massive blood loss. By massive blood loss, I mean blood loss that is more than 700 mils, such that the person becomes disoriented, or the person becomes fatigued, that he cannot even get up, or the person becomes what we call lethargic. So such bleedings, we term it to be catastrophic. So massive blood loss, usually from 700 mils and above, 1,000 mils, that's 1 liter, is catastrophic enough. Now you need to first arrest that bleeding. You can improvise. If you're on the field or it happened outside a hospital, please do well to improvise. You can use a piece of cloth to apply a tourniquet around the tourniquet above the injury site, about 2 cm above the injury site. In a different lecture, I'm going to discuss that in details. Okay, so you can apply what we call a tourniquet. You can also apply firm pressure. Usually we start from firm pressure. If the firm pressure cannot stop the bleeding, then you need to consider applying a tourniquet. If the tourniquet still cannot arrest the bleeding, then you need to advance again and apply a second tourniquet above the first one. And then if that still does not arrest it, if you are a medic and you have a tranexamic acid, you can use that. TSA can be used to arrest it. Otherwise, if you cannot arrest it with medications or other hemostatic agents, then you can just call for help and ask somebody to assist you to send the person to the nearest hospital. Then the second we need to consider here is the airway. Here you need to make an evaluation, critical reasoning, assess if the airway is open, if it is patent, and if it is well maintained or maintainable. Okay, so by being open, we mean the person can take in air and it gets to the lungs. Okay, so he has the ability to take in air. If he has a fractured nose, then we can suspect that the airway is not open. If he has a facial trauma, an accident that affected his face, and there is suspected head injury, crush injury to the face, then we can suspect that his airway is not open. By patent, we mean there is no secretion in the mouth. He doesn't have gum or dentures, okay, that have been dislodged, or saliva, or probably he was eating and then choking, okay, or maybe a disaster happens while he had something in his mouth. Such are hazards. So we need to ensure that the airway is patent, is open and maintainable. By maintainable, it means can you assist him to maintain an open airway or to ventilate. The third you need to consider here is breathing. Is he breathing as he should? Does his chest rise upon inspiration? Normally with inspiration, the diaphragm needs to distend, okay, to allow oxygen to get into the lungs. So does that happen? Or does it happen the other way, that when he takes in air, the diaphragm retracts, as you can see in case of a fractured rib? Okay, so you need to check the breathing. Is it rapid? Is it too slow? You need to also ensure that he's not complaining of pains in his chest. If he is, then you can suspect that there might have been a chest injury. It could be a blunt chest injury. It could be a penetrating chest injury. Another thing you need to find out here is the circulation. You need to assess him. How is the capillary refill time? Cap refill time, you need to press the finger, okay? Now, normal cap refill time should be less than 2 seconds. Normal cap refill time. If it exceeds 2 seconds for the blood, when you press the finger or the nail bed and release it, usually it should take about 2 seconds for the blood flow to be restored. But if that doesn't happen and it extends to 3 seconds or 4 seconds or even more, then you can suspect that this individual has a compromised circulation. Most of the time, when there has been that massive blood loss, what we call the exsanguination or catastrophic bleeding, you suspect that there's going to be a compromise in the circulation. When you're on the field, you might not have the tools to check for the blood pressure, but you can check for the pulse. So you can palpate the pulse by placing 2 fingers against the radial bone. Okay, so you can check the pulse and see what the value is going to give you. If the pulse is steady, of course, which can be seen or observed in a patient that has lost a significant amount of blood, then it's a cause for concern. On a different training, I'm going to talk about how to manage a rapid pulse. Okay? Now, another thing you need to evaluate for is disability. You need to constantly talk to the person if you are on the field or you are at a place where somebody has just been knocked over the road, has been knocked off by a motor vehicle, or probably the person has fallen from a height, or there has been a blast injury affecting the person's extremity, chopping off the extremity or the limb. Then it is ideal that you constantly speak to the person, call the person by name. Hey, Anderson, are you still with me? Anderson, stay with me. Anderson, are you okay? Let him respond. You use that to evaluate his level of consciousness. So keep him talking, and keep him talking. All right? Now, there's a quick tool we use to evaluate the level of consciousness. For the healthcare professionals, both pre-hospital and in-hospital, we always prefer the Glasgow Coma Scale, okay, which is a set of criteria we use to evaluate a patient's or an individual's level of consciousness, all right? But for pre-hospital settings, the health professional would like to do a rapid assessment, then we prefer then to use the AVPU. AVPU, I mean 4 acronyms, AVPU. A for alert. For someone who is alert, then you can give a rating of about 4. Okay, of 4, that's a rating. For somebody who is responsive to only voice, so you give 3/4. And for painful stimulation, probably he responds only when you tap him or when you pinch him or apply what we call a sternal rub. He responds only at those times. Then you give him a rating of 2/4. And then of course, when the individual is unconscious, you give a rating of 1/4 as the ABCDE scoring. All right? Or you just say 1. So the level of consciousness is used to evaluate, we use the disability criteria to evaluate that, the level of consciousness. And then also for disability, we'll also include checking the blood sugar level. If this happens at home, there was a traumatic event that happened at home, or probably somebody has just been shot at home. You need to run a quick evaluation before you start dragging him the way we used to, okay? Or before you call somebody to start wheeling him into the trolley, you need to do a rapid assessment of the blood sugar if you can, okay? This will help also to understand that this person will be sustained, or he has some glucose to sustain him up till the time you get to the hospital. And then we also have the exposure, which is the sixth point here. Exposure means checking the temperature. How cool or how warm is this individual? If the body temperature is cold or is low, then you suspect that this person would likely go into shock even before you get to the hospital. And if he's warm, it's a good thing, but still we do not want him to be too hot, because that can also impact on the level of consciousness and also would cause more bleeding when the body temperature is really high. Okay, so these are the criteria. I'll repeat it: the trauma care, exsanguination, airway, breathing, circulation, disability, and exposure. All right, so these are the six tools we use to evaluate and assess a patient rapidly or a victim rapidly once there is trauma. Okay, before you take him to the hospital. Even in hospital, you should still continuously use these criteria to evaluate and manage your trauma patient. Thank you so much for listening. Drop your suggestions as well, and also your questions. Once I see them, I'll do well to answer every one of you. Okay? Don't forget to like, share amongst your groups, and then subscribe so you can always get updates whenever I make a post. Once again, a good day and bye for now.